Hello and welcome to our lecture on pharmacology. The topic today is local anesthetics. As you are aware that local anesthetics, they are a class of drugs that temporarily block the transmission of pain signals from a specific area of the body. So they make you not feel pain because of temporary blockage of pain impulses. They work by interrupting the flow of electrical impulses along nerve fibers. Thus, it prevents the sensation of pain from reaching the brain. The pain stimuli, they don't reach the brain. So we have different types of anesthetics. As you know, there are a class of drugs or a class of anesthetics called general anesthetics, as well as we have local anesthetics. General anesthetics, that in which the whole body, it acts upon the whole body, whereas local anesthetics acts upon a part of the body. So we'll see what are the differences between general anesthesia and local anesthesia, or general anesthetics and local anesthetics. So that site of action in general anesthesia is central nervous system, whereas local anesthesia, it is peripheral nerves. The body area that is involved in general anesthesia, it is the whole body which is involved, whereas in local anesthesia, a part of the body or a restricted area, a small area, it can be a tooth, it can be a finger, or it can be a site of the wound, something like this. The consciousness is lost in general anesthesia, whereas in local anesthesia it is not changed, or it is unaltered, or a person remains conscious. Then care of vital functions. The vital functions like the heart rate, the blood pressure, the respiratory rate, all these things need to be monitored in general anesthesia, whereas in local anesthesia need not. You need not monitor any vital functions. The physiological trespass or the physiological functions, they require high action in general anesthesia, whereas low action in local anesthesia. Poor health of patient. If a patient is ill healthy, or a patient has poor health, then giving general anesthesia in that patient will be risky, and local anesthesia will be safer, because it requires it involves the whole body. And if any poor healthy patient, or poor healthy matlab, there is that person is not properly healthy, like ill healthy, or it is some diseased, so at that time giving general anesthesia and affecting the health is risky, whereas local anesthesia doesn't matter because it just acts on a part of the body. So if a patient is non-cooperative, then general anesthesia is possible, because you just need to give some drugs, and the whole body will go numb, and he'll sleep, he'll lose consciousness, and you can do the surgery easily. Whereas a local anesthesia, it is not possible. If the patient is not cooperative, he is afraid of the injection, you cannot give a local anesthetic to do any work. So in major surgeries, GA is preferred, and in minor surgeries, local anesthesia is preferred. So in major surgeries, general anesthesia is preferred. In minor surgeries, small surgeries like extraction of the tooth or suturing of the wound, at that time we prefer local anesthetics. We don't give general anesthetics. General anesthetics we need to give to bigger operations, bigger surgeries, like it might be head surgery or abdominal surgery or cardiovascular surgery. So, the surgery which has a prolonged duration in which you need to cut open or you need to do a major surgery to be performed, at that time we prefer general anesthesia, and for a smaller surgery we prefer local anesthesia. So you can remember this with the mnemonic SCAM V pump. S is for the site of action, C is for consciousness, A is for area of the body involved, M is for major surgery, V is for vital functions to be monitored, P is for physiological trespass, U is for use in a non-cooperative patient, M again is minor surgery, and one last P is poor health of the patient, wherein local anesthesia is safer than general anesthesia. This is the mnemonic to remember the differences between general anesthesia and local anesthesia. So next one, classification. We classify local anesthetics into two. Either a local anesthetic can be an injectable local anesthetic or it can be a surface anesthetic. Again, if it is injectable local anesthetic, then it is again divided into three. That injectable local anesthetic can be short acting, intermediate acting and long acting. The short acting injectable local anesthetic, the examples are procaine and chloroprocaine, and intermediate acting are lignocaine and prilocaine, and the long acting injectable local anesthetic are bupivacaine, ropivacaine and tetracaine. Apart from injectable, we have some surface anesthetics which can be applied like ointments. So the examples are lignocaine, second is the famous cocaine, third is tetracaine. So these are the surface anesthetics which need not be injected, which can be applied on the skin directly. So that forms the classification of local anesthetics. Now, mechanism of action of local anesthetics. Local anesthetics, they act by blocking the transmission of pain signals along the nerves. How they block the transmission of pain signals? They bind to and inhibit voltage gated sodium channels. So they prevent the inflow of sodium ions, inflow of sodium ions, and they prevent the generation and propagation of action potential. They prevent the propagation of action potential. Thereby, the pain sensation is it is blocked. The pain sensation, the conduction of pain sensation slows down and is blocked. So the brain will not come to know that there is a pain in that area because the impulse, the action potential is inhibited. That is, the propagation of action potential is inhibited. So this mechanism of action results in localized loss of sensation, allowing for painless medical procedure treatments in the targeted area. Wherever you inject the anesthetic, that anesthetic prevents sodium influx and prevents generation and propagation of action potential, thereby leading to slow conduction of impulse and the brain not recognizing the pain in that area. This is as simple as it is. So this is the way local anesthetics act. So next is the features of local anesthetic. A local anesthetic should have and should not have. What it should have? It should be stable in solution and readily undergo biotransformation. It should be relatively free from producing allergic reaction. It should have a long duration of action. It should have low systemic toxicity. It should have quick onset of action. It should be effective on both injection and local application. So remember SAD TO. S is for stable, everything is there in capital letters. S is for stable, A is for allergic, D is duration of action, T is low systemic toxicity, O is onset of action should be quick, E is effectiveness of both injection and local application. So these are the should have features of a local anesthetic, whereas the should not have features of local anesthetic are it should not be irritating to the skin and mucous membrane. When you apply it, the skin and mucous membrane should not be irritated because of the local anesthetic. And the second one is it should not cause any permanent damage on any tissue. Temporary damage, okay, again it recuperates, nothing happens. If it happens to be a permanent damager, then it is not said to be a perfect local anesthetic. So these are the features of a local anesthetic. Now the factors affecting the onset and duration of local anesthesia. So local anesthesia, the onset and the duration. So the onset and duration of local anesthesia, it depends on three factors. The first factor, the concentration of the anesthetic. Second one, the site of administration. Third is how much of volume is injected. So the concentration of the anesthetic is higher concentrations, they lead to faster onset and shorter duration. If you give higher concentration of anesthetic, it leads to faster action, faster onset of action, but the duration is low. Whereas if you give lower concentrations, they result in slower onset, but effects are long lasting. They last for a couple of minutes to hours. Site of administrations. Anesthetics, they have more effect if they are given in areas with good blood supply. Like face has a good blood supply. So if you give anesthetics on face, it will have more profound impact, or it will act for a longer period of time compared to areas with less vascularity, like the extremities, like the legs will have less vascularity. If you give the same local anesthesia in legs as well as in the face, the local anesthesia which is given in the face acts for a longer period of time than the local anesthesia which is given in the legs, all because of a good vascularity which exists in the face and low vascularity exists in the limbs. The volume injected, larger volumes of the anesthetic solution cover a wide area and lead to a more extensive block. If you give more and you keep turning your needle in different directions, more of anesthesia, local anesthesia will lead to an extensive area to be anesthetized, whereas but may also increase the risk of systemic absorption. If you give more local anesthesia, more extensive block, but the disadvantage is it can get absorbed and it can lead to toxicity. So that is the disadvantage of giving more of local anesthesia. So these are the factors affecting the onset and duration of the activity. Adverse effects of local anesthetics. Adverse effects of local anesthetics are divided into two. First is systemic adverse effects and local adverse effects. Systemic adverse effects are they include allergic reactions. There can be an allergic reaction, cardiovascular complications like arrhythmias, and central nervous system toxicity. So these are the systemic adverse reactions. That is, it involves many systems rather than local allergy, cardiovascular complications, CNS complications. So how will you minimize this? That is minimized by careful dosing. Need to calculate the dosage, careful dosing, and continuous and regular monitoring of the patient. That is critical or crucial to minimize these risks and ensure that the patient is safe. So these are the local reactions. The local reactions are, say, the first one is pain on injection. The injection, it can have a pain, it can give burning sensation. The injection can give burning sensation. Failure to obtain anesthesia, because if it is not given in the proper site and the proper way, anesthesia is not obtained. Or if it is given in a proper way but a higher dose is given, then persistent anesthesia that can be there for hours and can cause discomfort to the patient. Sometimes the patient is not cooperative, there can be needle breakage. Sometimes if it is not given properly in the required facial nerve site, it can cause facial nerve paralysis. Sometimes it can cause a trismus, the contraction of a TMJ, temporomandibular joint, because of the contraction of the muscles, masticator muscles. Then soft tissue injury, patient is not cooperative, soft tissue injury. Hematoma, if your needle gets pierces the blood vessel, then it can lead to hematoma. And if there is no proper sterilization, it can lead to infection. So these are the local adverse reactions. The systemic are three. They can be allergic, it can be serious complications, cardiovascular complications, and central nervous system, CNS complications. So the common adverse effects normally we encounter are numbness, tingling, dizziness, drowsiness, and nausea. In rare cases, local anesthetics can cause more severe complications like seizures, cardiac arrhythmias, or respiratory depression. So CNS toxicity can lead to seizures, cardiovascular toxicity can lead to arrhythmias, and respiratory toxicity can lead to depression. These are the systemic adverse reactions. Whereas locally, it can happen is tingling sensation, numbness, dizziness, nausea. These are the local symptoms. Allahu Akbar, Allahu Akbar. So contraindications and precautions for using local anesthetics. What are the contraindications and precautions? First is allergies. Second is cardiovascular conditions. Third is neurological disorders. Fourth is pregnancy and breastfeeding. If a person has one out of these four, then the local anesthetics need not be given. They are either contraindicated, or if they are really necessary, then it should be precautions need to be taken. Special precautions need to be taken. So if there is allergy, you can avoid local anesthetics in patients with known allergies to the drug or its components, such as sulfites or preservatives. So local anesthetics themselves sometimes cause allergy, as well as the preservatives which are used in preservation of local anesthetics like sulfides and other preservatives, they also can cause allergic reaction. If they are there and the patient is allergic to these drugs, then it is better not to give local anesthetics. At that time, if the procedure is really necessary, then you can go for a general anesthesia. Okay, then cardiovascular conditions, exercise caution. Here, if a person has cardiovascular conditions, there is no need for contraindication if he has to undergo, like for example, dental extraction. So if he has already cardiovascular history, dental extraction is necessary. So you need to be exercise and extra precaution when administering local anesthetics to patients with cardiovascular disease, as they may be more sensitive to the effects. Sometimes arrhythmia can occur suddenly by giving lignocaine. So at that time you need to do all the preventive measures. You need to take preventive measures. You need to keep a physician handy when you are extracting a tooth for a already cardiovascular patient. If you are giving lignocaine or if you are giving any local anesthetic, you need to have a physician standby, so that in an event of any emergency occurs, he can handle it. And the third one is neurological disorders. Again, if somebody has neurological disorders or conditions, then at most precaution needs to be taken to prevent extensive nerve damage. And then if a person is pregnant or she is breastfeeding, then local anesthetics, they should be used cautiously. They should be very carefully used in this pregnant and breastfeeding woman, as the effects on the fetus or infants are not fully understood. The local anesthetics should be cautiously given in pregnancy and breastfeeding woman, as the effects on the fetus or infant are not fully understood. So still studies are going on to know the effects of local anesthetics in pregnant and lactating women. So next is, if we compare local anesthetics, so onset of action, they can be compared by these four parameters, onset of action, duration of action, potency and toxicity. How potent and how toxic is it? So onset of action, if you see, lidocaine has a faster onset of action compared to bupivacaine, making it suitable for procedures requiring rapid numbing. Like if there is a dental extraction, we prefer lignocaine or lidocaine in that patient, because it has a faster onset of action. We need not wait for minutes or hours for the action to take place. Whereas bupivacaine has a slower onset but longer duration of action. So if there is a longer surgery, then we prefer bupivacaine, because it has a slower onset of action but longer duration. So we need not give lignocaine at repeated intervals and induce a toxicity. For that, one dose of bupivacaine is enough, because it has a slower onset of action but prolonged action. So it can, for minutes and hours, only one dose can sustain local anesthesia, and then the surgery can be properly done. So that is regarding onset of action. Again, the duration of action, as we said, bupivacaine has a significantly longer duration of action, up to 8 to 12 hours, compared to lidocaine's 2 to 4 hour duration. So if any surgery requires it requires more than 4 hours, local anesthesia, where local anesthesia is indicated, or a local surgery where the surgery will go on for more than 4 hours, you cannot give lignocaine every 2 hours and induce a toxicity. So for that, you give bupivacaine once, and till that action will remain for 8 to 12 hours. The whole surgery can be completed in one dose of bupivacaine. So that is onset of action. So next is, the third one is potency. Bupivacaine is considered more potent than lidocaine, although it has a longer duration of action and is also more potent. It requires a very less dose. So this increased potency also contributes to bupivacaine's longer duration of action. toxicity. Lignocaine generally has a wider safety margin and lower risk of systemic toxicity compared to bupivacaine, which has a higher potential for cardiotoxicity and central nervous system effects. Here we have pluses and minuses. Pluses: lignocaine is faster acting and it has a shorter duration of action. Small extraction of tooth, we require faster action at small duration. Right? Within 2 to 4 hours, we finish the extraction of the most complicated tooth. Whereas a longer surgery, a longer one, need to extensively suture and it takes more than 4 hours or 5 hours. One dose of bupivacaine in that affected area can lead to prolonged duration of action for 8 to 12 hours. But the one problem will be it is a more toxic. It has more toxic effects on cardiovascular system and CNS system. So these are the pluses and minuses of lignocaine and bupivacaine. So techniques for administering local anesthesia. So the first one is they can be administered through various techniques, including infiltration directly at the site of the wound or at the site of the, like if it is extraction, infiltration in the tissue surrounding the tooth. Nerve blocks, again you can block the nerves. Again, if it is a, like for example, a molar extraction wherein the molar tooth has to be the third molar or second molar, at that time we give nerve blocks so that the area supplied by that nerve, the whole area is numbed, or the whole area does not have a painful stimuli. So nerve block is given at that time. And then there can be topical application. The surface anesthetics like the cocaine and even lignocaine and tetracocaine, they can all be used as surface anesthetics, can be used for local application or topical application. The choice of technique depends on the location and type of procedure being performed. Whether you want to give infiltration or, again, small tooth infiltration, molar tooth, bigger tooth, the molar tooth, nerve blockages, and topical application in small, like for example you are putting a suture for a child. The child will be crying, and the small suture, to put that, you need not give an injection of anesthetic at that area. You can just apply one topical application, a surface anesthetic, and then suture can be done. So infiltration involves injecting the anesthetic directly into the affected area. Again, nerve block involves injecting the anesthetic near a specific nerve to numb the area that is supplied by that nerve. And then topical anesthetics are applied to the skin or mucous membrane to provide a numbing effect. Like skin, if it is to be sutured, then apply on the skin and the surrounding area with a topical anesthetic, and that leads to numbing of that area. So proper technique is crucial to ensure a successful and comfortable anesthetic experience for the patient. So this is regarding application, the different types of application of local anesthetic. Now, considerations for using local anesthetics in special populations. The special populations can be pregnancy, in elderly patients, in kids, in pediatrics, comorbidities like other conditions, along with a poor health of the patient. So what are the considerations? In pregnancy, the local anesthetics can cross the placenta. So dosage must be carefully adjusted to minimize risk to the fetus. Like if it crosses the placenta, it can lead to other effects, any teratogenic effects. They are fully not studied, but it can lead to different effects to the fetus. Mother requires some surgery, so that at that time we need to carefully adjust the dosage in such a way that only the mother gets benefited and the fetus does not get any harmful effects because of the anesthetic, local anesthetic. So in pregnancy, the dosage need to be calculated before administering. So decreased in elderly patients, the liver will be used up, like after so many years of work, metabolism will be decreased, and clearance requires lower dose of local anesthetics to avoid toxicity. Like metabolism is decreased and even excretion also is decreased. So for that matter, if you give more, even normal range of local anesthetic, it becomes a toxic because it is not excreted properly. So that's why again lower dose of lignocaine or lower dose of local anesthetic need to be given to prevent toxicity in elderly, in the old people. In children, it may require higher doses per body weight, per kg body weight, that needs to be calculated using, remember, a child is not half the adult. That is why for each kg there is some specific dosage that needs to be calculated before administration of the local anesthesia. If you don't calculate the dose and you simply give it, you are giving toxicity to the kid. The kid can have toxicity, risk of toxicity. Apart from getting anesthetized, there is risk of toxicity. Then comorbidities like kidney and liver disease, they can affect. If there is a kidney disease, the lignocaine or the local anesthetic cannot be filtered properly, and if there is liver disease, then the local anesthetic cannot be metabolized properly. Hence, in kidney and liver disease, even a small dose might look like a big dose, as it cannot be excreted. It will be there in the blood for a long time, and then that can lead to toxicity symptoms. So again, we need to be very careful when applying, when giving a local anesthetic to people who have liver disease and kidney disease. So this is regarding. So what's an ideal anesthetic? An ideal anesthetic should have these 4 properties. It should have rapid onset, it should be of prolonged duration, like as we said, the features of local anesthetic, the sad toe. Same thing here, we have an ideal anesthetic. It should be stable. Again, that it should have, that's the same, the previous slide. So the same slide summarizes here. It should be stable and should rapidly undergo biotransformation, and people should not be allergic to local anesthetic. So it should be, the duration should be longer duration. Then toxicity should be low. Then onset should be rapid, onset should be fast, and then effectiveness also should be more. So an ideal local anesthetic will have all these 6 properties. It should be along with that it should be potent. It should be selective. It should not unnecessarily anesthetize the surrounding areas. It should be safe and tolerable. It should be having less side effects. Okay, it should have a prolonged duration. It should be having a rapid onset. So thank you for watching. I hope if there is any doubt, or if there is anything which needs to be clarified, you can put in the comments below, so that it will be addressed in the next video. Thank you. May God bless you.